This is a study of the Queralt indices. The Queralt indices have been developed to perform a comprehensive risk adjustment for predicting in-hospital events. To do that, we used administrative data from the hospitalizations of the Catalan Health Institute. The risk adjustment is essential in fields such as management, benchmarking, and research. Measures that take into account comorbidity are usually used for risk adjustment, such as the Charlson index. However, in the field of hospitalizations, the total burden of the morbidity go further than only the comorbidities and depends on three factors, namely, the main cause of hospital admission, the comorbidities of the patient, and complications during hospitalization. In recent work, Ording and Sorensen explain the epidemiological importance of taking into account and differentiating the terms comorbidity, complications, and complexity. In broad terms, these three factors play a role in the endpoint, namely, the main cause of admission is the exposure, the comorbidities present at the time of admission act as confounding factors, and the complication that appears during the hospitalization process act as modifier factors. The Queralt indices collect the entire process from this epidemiological point of view with three sub-indices, such as the Queralt index for the main diagnosis, the Queralt index for comorbidity, and the Queralt index for complications. This study analyzes the performance of different adjustment measures for three outcomes: in-hospital mortality, length of stay longer than 14 days, and admission in the intensive care unit. For this, we use the area under the ROC curve as a synthetic indicator, although in the original work you can also see other indicators. As a comorbidity measure, the Queralt index for comorbidity offers better performance than the Charlson and Elixhauser indices. Adding to the model the effect of the main cause and complications clearly improves performance. It also offers better results than the level of risk and severity of the all-patient refined diagnosis-related groups, although the diagnosis-related group system takes into account diagnoses and procedures, while the Queralt indices only use diagnoses. The same analysis that was carried out on the total number of hospitalizations has been repeated by specific groups of diseases and can be seen in more detail in the article. Probably the most used measure for risk adjustment in hospitalization settings is the Charlson index. There are two main differences between the Charlson index and the Queralt indices. Firstly, the Charlson index used just 17 pre-selected chronic diseases, while the Queralt indices take into account all the diagnostic codes from the electronic medical records. This fact implies that acute illness is also taken into account. Secondly, the Queralt indices offer not just one measure, but three: an index for the main cause, another for comorbidity, and another for complications. This reflects in ways the epidemiology complexity of the cause, confounders, and modifier factors for the in-hospital endpoints, thereby showing a better adjustment than other measures. The software to calculate the Queralt indices is available free to use through our website.